Hello, good morning, everybody. It's still just about morning. You may or may not be aware that April is Rosacea Awareness Month. Rosacea is a condition that we come across quite a lot here at Exodus. We see a lot of clients for their skin conditions, and rosacea is something that we deal with quite frequently here. Ultimately, rosacea is a very big umbrella term for a lot of things that people present with, but ultimately it's a chronic inflammatory skin condition characterised by the sort of things we get people complaining about is redness, inflammation, irritation. There can be soreness sometimes in severe cases. It is often accompanied by acne, so you get your acne rosacea clients. Flushing sort of changes, suddenly going very red. And also one of the things that we see an awful lot of is reactions to environmental factors. So things like changes in temperature recently, where the temperature went from really nice and quite pleasant in February, suddenly got very cold again. That change from central heating to freezing cold outside can cause flushing of the face, and that is a sort of quite a classic sign. Stress is another big trigger, cortisol release, and stress hormones actually play a part with rosacea as well. And the other most common thing is food and drink. So food intolerances, dairy is quite a big trigger, gluten can be a trigger for rosacea, and reactions to alcohol and caffeine. So those of you that are your caffeine addicts, you can't get through the day without your coffee, or you're drinking your gin and tonic at night, actually people often say that that is one of the things that seems to flare up redness. It's such a big condition, and there are as many different sort of symptoms and problems associated with it as there are people who have it, really. And often people end up being treated for things like eczema, psoriasis, allergies, when actually it eventually then ends up being rosacea. Symptoms, as I said, quite often you get the sort of redness and things like that, but sometimes it can be very mild. My rosacea now is very settled. It's not great light in here today, so I don't know if you can see my skin. I get quite a lot of redness, but because of the treatments and home care that I've been doing over the last couple of years, what I tend to just get is a sort of just general redness across the cheeks, instead of the sort of full-on broken veins and all that we've actually managed to get on top of. I'm conscious of the light in here, actually. That's a little bit better, isn't it? So there's a lot of things that we can do for rosacea. Obviously, what I can't do is I can't control your environment. I can't control your stress levels, although coming to have some treatments here can actually help with that sometimes. But generally speaking, I can't control your environmental situation. I can help advise on the sort of food and drink and alcohol and caffeine, that sort of thing. But ultimately, those changes are for you to work out for yourselves and to do trial and error on things that affect you. I know that caffeine does sort of flare mine up a little bit, so I have to be careful, but I am a bit of a caffeine addict, for those of you who know me. But what we can do is help the skin condition and actually help reduce the symptoms of rosacea. It's one of those conditions that isn't sort of curable, and it is progressive. So generally, if you start getting rosacea symptoms, they tend to progress unless you keep on top of them. They can be kept on top of, and occasionally you'll get a flare up, but sometimes you do need to sort of keep doing what you're doing if you're getting good results, and keeping on with home care products and treatments to keep on top of those problems. Changes in temperature, I said, different seasons can sometimes flare it up. A stressful situation can flare it up. Hormonal changes as well, having babies, menopause, those kind of things can also impact the long-term condition. It is something we see a lot of, and it is nice when you can get on top of the really severe breakouts, the sort of big inflammatory conditions. And like I said, there's lots of different symptoms around rosacea, but one of the things that does seem to be similar in all clients is that the protective layer of the skin is compromised in some way. It's called the acid mantle, and it is the layer that is there as the shield from the outside world and from the inside out, and it is a protective layer across the surface of the skin. So one of the things that I prioritise when seeing clients with rosacea is rebuilding and strengthening that acid mantle, because quite often the condition itself will cause that to become less protective, but also a lot of the treatments that people have gone through to try to resolve the rosacea issues damage it in some way. So harsh treatments, sort of long-term creams, sort of prescription creams and things like that, that while they can help reduce symptoms sometimes, don't necessarily look after the skin. So it's about protecting the skin first of all. So often what I will do, particularly if somebody's got a lot of inflammation, if they've got sort of symptoms that look a bit sort of more like the sort of eczema type problems with the skin, the sort of very inflamed, sore looking rosacea, one of the first things I will do, I won't start treatments, we won't go down that route until we've got that a little bit more protected. This light keeps changing. So one of the first things I'll do with a rosacea client is send them away with our post-procedure kit, because what is in here are 3 very calming and soothing products that will last about a week to really start to just settle everything down, start getting the skin protecting itself again, before we then start going on and recommending anything more active, because we need to really dampen down that inflammatory response first of all. So in one of these kits, you will have a Sensa Calm cleanser. So it's very rich, it's very soothing, and it will help it doesn't strip the skin more than it already is. I don't know if you can see one of these. Okay, we give these sometimes after peels and clinical treatments here, but this is the first line thing that we will give. The second product is called Recovery Balm. For those of you who've had treatments with us before, know how lovely that is. Recovery Balm it's quite a rich moisturizing cream. It's almost a barrier cream. It feels quite nice and rich on the skin. Got lots of soothing ingredients, lots of anti-inflammatory ingredients, and it's one of the few of our products that actually smells of anything. There's nothing unnecessary in any of the Illumia products. It just happens that the ingredients in Recovery Balm happen to smell really lovely as well. So it's a really nice, calming, soothing cream to put on the skin. The other essential ingredient, the other essential product for rosacea, for any skin types actually, but particularly in the situation that we're in and trying to settle people's skin, is sunscreen. So we should always be wearing a sunscreen, and the sunscreen that we recommend for this, there would be 2 that we could possibly use, but Sheer Hydration is a light, hydrating, easy to apply sunscreen that goes on easily and is that final protection against not just UV light but against the environment. So it is protecting your skin during the day. So I would literally send someone home and tell them to get off everything that they're using at the moment, spend a week just with a post-procedure recovery kit for a few days to really start to get on top of that. We would then move on to perhaps some more in-depth products for home, and I'll go through those in a moment. And then we'd be looking at treatments that we could offer. As with any skincare issue, there's no magic wand. This is a process. It's about constant assessment of the client, looking at how they respond to different treatments, different products, and spending the first sort of 3 to 6 months with a client, really working out the best route for them, because rosacea is such a huge subject. It's about getting the right results for them and getting what we can, moving them forward that's in a way that's best for their skin. So we would carry on with home care products. So the same cleanser that's in that kit, which is the Sensa Calm, you could possibly move to a different one at that point as well. If they don't need anything like the Sensa Calm, we could use our gel cleanser if they prefer a wash, but generally that would be the one we could continue using. They would be continuing with the sunscreen, and then there's a range of other things that would help. So there is Calm R Serum. So this is a home care product that is designed, as you can see, for redness relief. It is designed for rosacea type skins. It's designed for sensitive skin. And this can be used in the first instance as frequently as sort of 3, 4, 5 times a day if you're having a bit of a flare up. But generally you'd be using this twice a day after you're cleansing your skin. And that's a really key ingredient for rosacea. Ultimate Boost for Hydration. This is another serum that can be useful. It's a gentle but effective peptide-based hydration serum. And then night moisturizers, you would be including things like Hydra Calm. So this is a night cream that has some of the elements that you will find in Recovery Balm. So it's a really nice one to keep using. It's not as heavy as the Recovery Balm, so it's one that you'd be using every day. So you can carry on using that one once you've got past the acute inflammatory stage. So we could build a prescription bespoke home care package once you've got past that first couple of weeks of dampening down the real inflammatory response. We also then offer a range of treatments that go alongside that, and actually it's important to do both together. If I get people in for treatments, what they do at home is very important as well. From an aging point of view, if people sort of want to have anti-aging treatments but don't want to use a sunscreen, for example, it's actually not worth them investing in the treatment if they're not going to do the right things at home. So we look at the products they're using. Some will be fine, some will be recommended to change depending on what they're trying to achieve. From this point of view, if the right things aren't being done outside of the treatment arena, actually you're going to not get the sort of results that you're looking for. So what you do at home is very important. Bear with me, sorry, something's pinged up, I can't see. There is a range of treatments that we would be looking at, and there would be a combination put together depending on the client. Excuse me. One of the key ones for redness, and it's probably the most important when we're looking from a vascular point of view, so the flushing, the broken veins, if you've got the little spider veins, the broken veins on the face, the cheeks, quite often a patch on the chin, that's an area that I suffer from. Probably the key treatment for those issues is the laser and IPL type treatment. So if you can see behind me, I don't know how much of this you can see, the Luminous M22 is a medical grade laser, and it has the IPL handset on this side that you can see here. If I can reach that. So there's different sizes of light guide on the IPL system, and we change the filters here depending on the condition that we're trying to treat. So you'd have a different filter in there for pigmentation on the skin than you would for vascular, because there's different parts of the skin that you're trying to target, so the filter would change. Nice small contact here for veins, small areas, and we have a bigger one as well to target the whole face for sort of flushing across the skin. So we can treat spot areas. You know, this is the size of light guide that we would be using. You can see it's a lot bigger than the other one, and that would be used across the surface of the skin, as well as the more pinpoint treatments for the veins, individual veins and individual areas that we need to treat. So we would tend to treat the whole face first of all, excuse me, and down the neck if it's needed, to work on that general redness and flushing, and then we tend to go back across and pinpoint the small veins that need closing down. People could be a little bit concerned about this, but ultimately those veins that are constantly visible aren't functioning efficiently for you anyway, so you just target the blood cells in those. It helps, it effectively kind of collapses those little veins down. The body will break those down and take them down and then reroute more efficiently. So you lose that redness on the chin, on the face, those visible veins. I used to have very visible ones around my nose that I'd have to use concealer on every day. That doesn't happen anymore because we've closed those down. The blood is redirected more efficiently. So that is a really key treatment for rosacea. However, what that isn't going to address is sort of the skin health and function when it comes to dryness, irritation, and that kind of thing. So we can get on top of the redness, but what I like to do with rosacea is alternate between the IPL system and usually something like mask treatments or skin peels. The skin peels we offer here are the same brand, so we're looking at the Illumia brand of peels. They're what we would call superficial treatments. And what that means is that they are interested in the function of the epidermis, just the very top layers of the skin, where all the structures are that we need to focus on. We don't need to go deep. We don't sort of go down the route of deeper peels where you get a lot of sort of flaking and shedding, get a little bit of powderiness occasionally. But for rosacea, we're going to treat very gently. We want to just get the skin functioning a bit more. We want to reduce it if it's feeling a bit compromised. And those peels can be really, really helpful for refreshing the skin and making it feel less irritated, getting it functioning better for you. And alongside the treatments that you're doing at home, it can be really helpful in toning down the symptoms of rosacea and getting a better sort of health of the skin and just getting it feeling better for you. So everybody who is seen is given that prescription, that advice. They will to have that in by email, in writing, so you can go away and make a decision. But ultimately it's worth, if you're going to go down the treatment route for things like rosacea, it's worth committing to going through the process that we recommend, so you can get the best results, and we can keep assessing you and making sure you're getting the right treatments as you go along. It's nice to see a few people popping in and out here actually. So hi Guy, hi Richard. And the one thing that is important as well, talking about our consultations, is that there's no obligation to book anything. I would very much prefer someone came to talk to me and have that prescription given to them, understand exactly what it is that is recommended, without feeling kind of, you know, oversold to and feeling like they, you know, they're sort of forced to book anything. It's really important to me that you understand exactly what it is we recommend and why we recommend it, and go away with it all on paper so you can actually make that decision, and then come back and ask me and book it in things as you feel are appropriate. But like I said, I would always prefer somebody committed to a process, because it's the process that will take you a long way and get on top of that condition. As we said at the beginning, rosacea is a huge area. It's a very big subject. There's as many symptoms as there are people who have it. There are lots of triggers, and sometimes it can get, you know, it can take some digging to get on top of that and to find out what those triggers are. But ultimately, we can offer an awful lot to settle those symptoms and to help somebody with a skin condition that can be really quite debilitating. So if anybody's interested in a skin consultation, please do let us know. We don't charge for those. We do take a deposit, but we don't actually charge for those. So it gives you the opportunity to come and see for yourself what can be offered and make a decision based on that advice. I think I might have a comment here. Thanks, Sue. Yeah, so Sue has been to see us and had a recommendation. So she's had her emails following that consultation and is now able to make those decisions about the recommendations that we've made. So it is something we do an awful lot of. Do come and have a chat with us. There's no commitment, there's no obligation to book anything, but we can advise on the best things for you to do moving forwards. So if you're interested in either the home care or the treatments, or both ideally, just let me know. Any questions, ping them here. I can always come back and answer them later. And I'll drop some before and after pictures in as well, so you can see some of the progress we've made. Some of them are very vascular, so it's more about closing down those sort of ineffective blood vessels and reducing general redness. And there are others where we're looking at a much more inflammatory condition and getting on top of that before we can worry too much about things like the IPL and those kind of issues. So it's been great chatting to you. It is Rosacea Awareness Month, and I've just realised there's a spelling mistake in my title. I'll go and correct that. Come and have a chat, and I will speak to you again later in the week. Take care. See you later.